Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle here with Dr. K. And Dr. K, I have a question for you.
What's that?
My shoulder hurts. What are you going to do to me in 45 minutes?
Laugh at you.
Oh, dang it. I thought you were going to just push where it hurts really hard and then make it hurt more.
Yeah, pretty much.
And then make it go away somehow.
No.
So, but for real though, say I have a shoulder injury. A part of what we do, what you do, I don't do this. Don't trust me with a needle. I am not a doctor, folks. But a part of what you do is injections.
Yes.
Regenerative injections. So
Yes.
It's a big category of things, but I'm hoping today in our stripped down episode of regenerative injections, you can help explain to us the levels of injections and then why you would get certain injections over others.
Yep. So there's different tiers. There's Prolotherapy, which is kind of started all this, and all the way up to quote unquote stem cells. If you want to know why I'm saying quote unquote, go back 6 episodes, and you'll see why I'm saying quote unquote. But regenerative injections, at a principle, are injections that are designed to try to heal the injured tissue and replace it with normal, healthy tissue.
So when we do this, there are different ways that these injections work. So let's just start with the, say, entry-level, most affordable injection. Yep. What is that?
So we're specifically we're forgetting steroid injections. Yes. Those are not a thing that I believe in. I believe that those take away inflammation temporarily and make you feel better. But what happens is over 3 to 6 to 12 months, however long it lasts, you're using that area more. And so you're actually wearing it down even more. So when the steroid pain relief wears off, you're in a worse boat than you were a year ago. And there's studies proving this, that there's increased levels of arthritis 5 years of doing a steroid injection versus non-steroid injection. The incidence of arthritis increases in that joint.
Which is only compounded if you do a series of 3 or 4 of them.
Yep. So we're talking about Prolotherapy, PRP, and MSCs, aka stem cells. So the one you're alluding to first is Prolotherapy. It's dextrose. It's sugar water. So when you inject it, it creates a lot of inflammation, irritation. So the first question is, why do muscles heal really well, whereas tendons and ligaments don't?
Well, it has to come down to blood supply, right?
Exactly. Muscles have really good blood supply. So when they get injured, your body can wash in, send in more healing factors and repair them. Tendons and ligaments have really bad blood supply even when they're really, really healthy. So when they get injured, your body has trouble repairing them.
So in order to help the body repair them, you would give it a substance, Prolo in this case, to send a signal, right?
Yes.
So it sends an inflammatory signal.
Yes. It stimulates the immune system to create what's called neovascularization or new blood vessel growth, to grow more blood vessels to the area, and along with that, bring in all the healing factors you need.
Okay, so say I tore a tendon in my forearm. Mm-hmm. You could do a Prolo injection. Is that going to help it heal faster, or do I need a bunch of them, or how would we approach that?
The typical rule of thumb for Prolotherapy is it's 4 to 6 treatments, usually every 2 to 4 weeks.
Okay, so the 2 to 4 weeks is, I'm guessing, is important, right? Because if you do 6 treatments over 2 years,
it's not going to do a thing for you.
Okay.
Because you're constantly building on those healing factors. There's what's called a proliferation phase, where all the growth factors get sent to the area and they do their thing and kind of die off. So if you can keep building on it, it's a stepwise formation. Whereas if you do them like spread out over 2 years, you're just not getting building effects.
Okay, so probably going to need 4 to 6 for a normal average injury, something bad.
Yep.
More, I would imagine.
So I typically, if we get to severe injuries, I know that I have colleagues out there that do treat severe injuries with Prolotherapy. I just don't think that the treatments, they're not as effective. You have to do a lot more of them, and I feel like they, quote unquote, wear off.
That makes sense. So Prolo is kind of the entry-level regenerative injection.
Yep.
In terms of price, we're looking at
$200 to $600 is kind of the range for it. We're at $200.
Yeah. So $200 to $600, multiple rounds.
Yep.
So say, hey, this is really annoying, this thing I have in my forearm, this hypothetical thing. I don't want to come to you for the next 2 weeks, every 2 weeks, to do 6 injections in this.
Yep.
How can I do it in 3?
So that's where we go to PRP. So PRP is platelet-rich plasma. That's where we take your blood, we spin it down, we concentrate all the healing factors that we normally need to get sent to an area, and we do direct injections with it, so instead of waiting for your body to send the healing factors there, we're putting them in. Plus, PRP is more inflammatory than prolotherapy, so as a result of those injections, you get more immune modulation to that area.
More inflammation equals more signal.
Yes.
Okay. So if Prolo causes a inflammatory response and PRP causes
about 3 times as effective.
So causes a more inflammatory response.
Yep.
Does it hurt more?
Yes.
Okay. So when you do Prolo, and I have from experience done Prolo, on a scale of 1 to 10, it probably hurts maybe a 3 or 4.
So if we call it, PRP is the most painful one we do. If we call it, PRP is a 10 out of 10. Bone marrow, your own stem cells, is an 8 out of 10. Adipose, your own stem cells, is a 7 out of 10. Prolotherapy is like a 5 to 6 out of 10. And then donor-based stem cells are usually like a 3 to 4.
Okay. So PRP, more painful in terms of inflammation response versus Prolo.
Yep.
And it's probably the top in terms of the pain scale.
Yes.
So this pain is not forever. Obviously, we're trying to heal something. Is this a transient thing?
Like 3 days.
3 days. Okay. So I've noticed for me that 3-day rule holds very consistent. So day 1, I'm like, oh man. Mm-hmm. Day 2, it's like, it's a little better. And day 3, I'm about back to the kind of normal pain level I was at.
Yep.
And then the healing takes how long, basically, after that?
You start to feel better in about 3 weeks, full lock-in in about 6 to 8 weeks.
Okay, so if you need multiple rounds of PRP, how frequently would you do those?
Every 3 to 4 weeks.
So instead of 2 to 4 weeks, you would do 3 to 4 weeks. You space it out a little bit more.
And you also only need usually 2 to 3 treatments.
Okay. So say we step up. Well, let's talk about cost for PRP first, because I know there's 2 different
So
styles.
let me add a little caveat. There's PRP and then there's PRF. PRF is platelet-rich fibrin. That's where you take your PRP and use a different mixing system and make it a jelly-like consistency. This is typically used for cosmetic procedures. It's a good filler. There are people that use it for joint injections. I don't see much benefit to using it for joint injections compared to other products. Mostly it's a cosmetic filler product.
Okay, gotcha. And then your cost for PRP treatments, because I know there's like a discrepancy in the marketplace, because I've heard of people saying, hey, I found PRP for $400.
Yep.
And then there's other people saying, hey, I found PRP for $1,800.
Yeah.
So what causes some of that cost discrepancy?
Quality of the kits that we're using. So PRP, you have to make PRP, right? So we can make it in test tubes, but that's what I call dirty PRP. It's full of red blood cells. It's incredibly painful, but it costs me like $3 to make. I'll actually use that. Used that myself once. I'll never do it again. I wanted to try it. Yeah, lesson learned. I wanted to try it and see what it was like. Never again. And then there's what's called single spin kits, double spin kits, leukocyte rich kits, leukocyte poor kits. All this has to do with the quantity and quality of PRP you want to make. Cheaper kits are single spin, which means they're only spun once, which it just removes the red blood cells basically and just leaves behind plasma. Double spin kits first remove the red blood cells and then spin your plasma again to strip out all the growth factors so that you can pull away most of the plasma and get hyper concentrated healing factors. So that's kind of the difference. And those double spin kits are obviously way more expensive.
Yeah, way more expensive.
About 5 times the price.
Yep.
So, we could buy a single spin kit for $100-$150 all in, whereas double spin kits all in, they're probably costing us $300 to $500.
Yeah. So we're looking at, treatments with us are anywhere from like $1,000 to $1,300.
That's pretty much a range for musculoskeletal. We do cosmetic treatments because you can use single spin kits for cosmetics and they work really well there. So those we start at $400.
Yep.
But if you want true musculoskeletal pain related, I need higher quality, higher volume kits.
Okay, so that makes sense. So we've got Prolo, we've got single spin basic PRP.
Yep.
We've got high level PRP, double spin,
Yep.
good high quality kits. Say I don't want to come in 3 to 5 times and I want to come in 1 to 2 times. What
now
do I
you're
do?
talking about quote unquote stem cells or MSCs. And we've talked about this like 7 episodes ago. Just go watch that if you want to understand the difference in MSCs, but we can get them from you. We can get them from somebody else. From you, we get them from your fat, from your bone marrow in the back of your hip, or from your blood. Blood is V cells. Bone marrow and fat we harvest from you.
So if you want to hear more about V cells, listen to our episode on V cells. We go pretty in depth about the V cell process.
Yep. This episode is just an overview of the different options out there.
Okay. So adipose, you want to do adipose first?
Sure.
So it's a liposuction that you do?
So we do a mini liposuction procedure either from your belly, your back, or the side of your leg, wherever you carry the most fat. Very thin people, I just won't do it. We're going to be there for 2 hours. You're going to hate it. I'm going to hate it, and it sucks.
Yeah. So I think it's important to note this is not a cosmetic liposuction procedure. This is a mini.
Yes. So we're not removing the fat to make a noticeable difference. There's a chance that you'll dimple just from the removal, but it's not designed to be cosmetically different.
Okay. So in terms of like how that process looks, it's basically, to my understanding, I've had it done not with you, but somewhere else years ago. Basically, they just took a needle and numbed me up and then just sucked out some fat with a specialized needle.
Yeah, you put in what's called tumescent fluid first, which breaks up the fat, makes it more liquidy, and then use a special needle just to suck it out.
Okay. I did not enjoy that.
No, it sucks. And then you get like a really hard belly for like a month because you break a bunch of blood vessels.
Yeah.
It works. It's just there's downsides to it.
Yeah, I literally had a spot on my stomach that was hard it actually lasted a long time for me, like a year. Mm-hmm. And it's
a hematoma.
Yeah, and I hated every minute of that procedure. Yep. I was like, get out of my stomach with your needle, please. So that's that process. Mm-hmm. Bone marrow.
We go in the back of your hip with a rather thick needle. It's actually not painful. We numb you up pretty well. People describe it as deeply uncomfortable because there's a needle and a vacuum sensation come from the inside. It takes about 10 minutes. It's actually, I can guarantee my procedure time for bone marrow. It's 10 to 15 minutes every single time. Adipose is highly variable.
Depending on how easy the fat is to get out.
Yep. And then we just suck out your bone marrow and then inject it.
Okay, so I have not done that, and I do not want to do that just because of...
Tried it once, didn't like it.
I do not want anybody in my bones with a needle.
That carries your highest risk of infection. I've never had an infection, but that carries the highest risk.
Okay, so in terms of effectiveness for regenerative injections, adipose versus bone marrow, do you see a difference?
At 18 years old, they're equivalent. At 60 years old, adipose far outweighs the bone marrow. Adipose, our stem cell concentrations remain relatively flat. There is a slight decline. Bone marrow, it's a significant, usually 10x drop.
Okay, so basically the older you are, the more you would want to avoid doing a bone marrow procedure.
Yep.
Okay, so say I have an injury that's fairly severe. Are we talking one set of bone marrow or adipose, or 2, or maybe 3?
If it's severe, what I typically say is 1 bone marrow or adipose followed by 2 rounds of PRP.
Okay, so you kind of stack them.
Yep, so huge booster shot and then 2 PRP shots for support.
Okay, gotcha. And then one more step up, kind of the creme de la creme.
Donor tissue.
So you please explain this to us because there's different tissues used for different things.
So there's umbilical, placental, amniotic. That's pretty much it, right?
Yeah.
So these are guaranteed count, guaranteed cell products that they come from a donor. Live birth C-section agrees to donate, tested for every drug and disease possible. So same as an organ transplant, processed and shipped to us, usually cryo-frozen, which means -80, tissue preserving, freezing. And so what we do with those, they come in a nice vial, and then I numb you up and I inject them. So there's no procedure you have to go through. It's just the injection. You're sore, bone marrow and adipose, you're sore, not even from the procedure. Wherever I inject it, you're sore for 7 to 10 days. With donor tissue, you're sore for 2 to 3, and it's nowhere near as bad. Think about that 10 out of 10 scale I talked about earlier.
Mm-hmm. So on these, we didn't touch on cost on bone marrow and adipose, but I imagine it's less than donor tissue.
So bone marrow and adipose, they're usually, at least we do flat fee costs. I don't even know what we charge. I think it's like around $4,000.
Yeah, it's like $4,000 to $5,000.
Yep.
Yeah.
And we're kind of in the middle of the market on those. The reason, our whole thing here is to be at the bottom end of the market so people can actually afford this stuff. Those are higher risk procedures. They take a lot of my time. So we're kind of sticking around the middle of the market.
They're much more invasive.
Yeah. I've heard as little as $3,000. I've heard as high as $10,000.
Okay, so and then when it gets to this donor tissue, what are we looking at in terms of cost? I know there's probably a super wide range.
So, there's places that charge a flat fee per milliliter of it, and that flat fee might be $1,000. It might be, I've heard, $4,000, $5,000, $6,000 per milliliter. And this stuff, the product itself ranges in cost from $200 up to $1,000 a milliliter. So
it's just basically the product you use is determining the price.
Yep. And then as I'm sure our listeners know by now, we have a unique pricing model where we pass forward the cost of the product. We just use a really expensive product. It's roughly $1,000 an ml, but we just pass forward that cost. And then we just charge a flat administration fee, which if you want this high-level product, it makes it as affordable as possible. We can follow that same vein with umbilical cord or exosomes. It's the same idea. We pass forward the cost of the product plus charge an administration fee.
Yep. Okay. So in terms of injections for a fairly severe injury, when you do donor products, what are we looking at? 1, 2?
1 to 2. It truthfully depends how severe and where is the severity. Oftentimes, we can get away with, what I've learned is I can get away with, in 90% of people, 1 donor tissue injection plus some laser and PEMF sessions will tend to take care of it. Just because we use a ton of volume of the stem cells. There's places that tell you have to do it 2 or 3 times. They're just taking that same volume. Like, let's say I'm giving you 10 cc's up front. They'll just take 2 or 3 cc's and break it up over 3 sessions. So instead of paying, $12,000 up front, you're paying $3,000, $3,000, $3,000.
Mm-hmm. Okay, so that makes sense. So basically, because of our pricing model, you're incentivized to get the maximum volume you can for maximum healing up front because it's more affordable because we pass on the volume.
Yeah, and the reason that I want it like this, I want my patients to get better. I want to know that they're getting better and that we're not skimping on volume because of cost.
Yeah. No, I like that. I mean, that's huge. So because I don't necessarily hate injections, but I don't love them either. I don't love getting poked. I don't think anybody really loves it.
Right.
So
say this.
Yeah. The least number of times I can get injected is a win for me.
Yep. Exactly.
So I'd rather not come and inject the same area 3 times.
Yep.
If I can get all that same amount in healing in one round.
Yep. Now the other aspect of injections, so it's not just the product, that's one avenue. The other aspect is your practitioner. Let's say you have an MCL tear. There's a lot of practitioners out there that unfortunately say, hey, I'm just going to do 1 shot in your knee joint. You're going to be just fine. Probably not. You need someone that will go directly to your MCL and go into the MCL. My personal saying is if you're off by a millimeter, you're off by a mile. You missed. The product that I use, the amniotic tissue, does not move. It stays wherever you put it. So if you put it into some random muscle instead of the tendon you were aiming for, you just wasted it.
Mm-hmm. So you do, basically your whole method of this is precision targeting.
Correct.
Like where you're going to go find the source, the exact source of where it's coming from, and you're going to hit that area.
It's ultrasound-guided, because an ultrasound, it takes 1 millimeter and makes it like that big, so you can see really, really well.
Yep, so you can see exactly where the injury is.
Yep.
Okay, so what else do we need to know from regenerative injections?
I think that's pretty much.
I will talk just a short bit about stacking.
Sure.
So you mentioned the laser and the PEMF.
Yep.
And if you want to know more about stacking those, listen to our episode on modalities. I think they are a huge benefit to stacking those. But on top of that, if you want to take it one step further, I would also stack a combination of BPC 157 with TB 500. Peptides. So they're healing peptides.
Yep.
I like to have people do, and I'm not sure if you agree with this, you can tell me if you do or not, but 3-month course is gold standard.
Yep.
But I like to have people do 1 month before the injections and then 2 months post-injection for the best results.
That's if we have the luxury of planning for that. That's some aspect. A lot of people walk in and are like, hey, I hurt my shoulder. I'm like, okay, I'm not going to tell them to come back in a month while they're in shoulder pain. Yeah. But if they're like, hey, I've had chronic knee pain, I'm thinking about doing this in 2 or 3 months, then that's when we would stack the BPC.
That's regenerative injections, folks. Thanks for joining us on the Peak Performance Podcast. I'm Coach Kyle here with Dr. K.
We'll see you guys next time.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.